Well, Victoria joins me now from the BMA, and also here junior Dr. Rachel Clarke, who supports the latest call for strike action. Now, Victoria, isn't this a bit of a risk, in fact, an incredible risk for the BMA?
Yes, and I think they recognise this. First of all, the junior doctors had really pushed for this meeting today because they said time was of the essence. This contract imposed by Jeremy Hunt and the government is due to come into force in October, and they said if they were going to reject it, as their members had, they needed to show strength, as it were, in numbers. Now, the BMA Council, my understanding, sources tell me, is that on the first vote it was divided right down the middle, those for and those against taking further industrial action, cognizant in many ways of the support that they might lose from the public, and that support has been very high, actually, despite taking 1-2 days strike action over the past 6 months or so, since January. The next vote of the BMA Council, it was only 2 more members, my understanding is, who said to go ahead with this industrial action. Now, at the moment, they're only talking about September, but all indications are that it will roll on until somehow they can get back around the negotiating table. And at the moment, it's quite hard to see how that will happen.
Victoria, thanks very much. Rachel Clarke, you've been listening to all that. 5 days. Are you being serious?
I couldn't be facing that with a heavier heart. No doctor could possibly pretend that that isn't a huge and serious undertaking, and nor could we pretend it's not without potential risks to patients.
Is it irresponsible?
No, and the reason for that, I believe, is that this essentially is the kind of risk assessment that doctors make day in, day out when we assess our sick patients. Of course, there are potential risks to striking, but at the same time, there is an enormous potential risk which the Secretary of State and his government are undertaking by a year ago, promising the public a 7-day NHS, but not funding it and not staffing at it, and saying that they will deliver it solely by renegotiating the contract of a finite number of junior doctors.
But if you're one of those 13,000 people whose operations have been cancelled, frankly, that stuff is irrelevant.
I don't think it is irrelevant.
Well, it is to them.
Well, last week we heard stories about entire accident and emergency departments being closed because there aren't enough junior doctors to keep them open. We're hearing reports of whole departments in some hospitals, obs and gynae in a hospital in Oxford, being closed for the same reason. There's a crisis in the number of doctors in our health service at the moment. And so how, in that context, can you possibly safely stretch this workforce even more thinly? Because that's what Jeremy Hunt is pretending is going to make you safer at weekends.
So you're now going to strike for 5 days. There's a possibility of another 5-day strike in October and then another one in November.
Yes.
As we get into the winter season.
Yes.
This could go on and on and on.
Yes,
and
absolutely.
Both sides are digging in.
Well, I absolutely, and I think we've got to the point now where we clearly have to end this. This is ridiculous, and to do that, it's very simple. A year ago, the government said they'd deliver a 7-day NHS in soundbite terms: no funding, no resources, no doctors. The BMA, my union, unfortunately signed up to the fact that they would deliver said 7-day NHS.
They shouldn't have done that.
Cost neutrally. They shouldn't have done that. For a year, grassroots junior doctors have fought tooth and nail not to allow that charade to be imposed upon our patients, because we know stretching us more thinly is dangerous. Every member of the public knows that you don't get something for nothing. The only people who pretend you can are con merchants and politicians, and that's the charade.
But the public would also say, a lot of us have to work nights, and a lot of us have to work 7 days a week.
Yep.
And you cannot risk people's lives, whether you want a better pay deal or not. No
doctor goes into medicine thinking they're not going to work nights, weekends, bank holidays. We all do it. We do it gladly because we want to be there 24/7 for our patients. But if you want to take risks seriously, how can you possibly make weekends safer, put more doctors on at the weekend in the absence of any new doctors without pulling them away from Monday to Friday? That's the charade of this 7-day service.
Just so finally, do you think there will ever be a deal struck between you and Jeremy Hunt, or is that relationship just beyond repair?
In a sense, the personalities are not what matters here. He's the current health secretary, but the issue here is the policy. There will be no deal unless the government has an honest debate with us and the electorate. They have a duty of candour here. Either they are willing to resource their 7-day NHS, or they are not. And if they're not, we will never accept
And you're
a
prepared to
contract.
risk the support of the public?
I am confident that when it comes to the crunch, the public knows who to trust. The government have always pretended this is Saturday overtime. It's not. It's about their safety.
Rachel Clarke, thanks very much.